A stakeholder advisory group is a sort of gathering of key individuals, key partners from different organisations, different backgrounds, different areas. So the idea was to have 8 professionals from organisations connected to population groups who we might think are likely to be missing. That includes people from the NHS, GPs, people who have experience working in the health service, but also from inclusion health backgrounds. Alongside those 8 people, we also wanted to get 8 experts by experience, so people who have experience of missingness or of challenges in accessing the health service, similar to the things that we're talking about and that we've found. And we want to bring those people together, share those perspectives, share those ideas, share the kinds of experience that they've had, and use that as a foundation to build on in the rest of our work. When it works well, we were able to bring all of those perspectives together, combine those different sources of knowledge, and produce new knowledge that we might not be able to get from reading literature, just from interviews, or just from speaking to people individually. What we want is for that to bring new ideas that perhaps haven't been thought about by the existing research paradigm. And what we're able to get from these meetings and from people's discussion of their own experiences and from their reflections on how the system is or isn't working, is it brings a really grounded perspective that's based in the current realities for the health service and the current realities in people's living circumstances. And that means that when we're designing interventions and when we're talking about causes, it's all contextualized within that broader understanding of the world as it currently works. Otherwise, I think we would end up with some nice ideas, but I think people might look at them and think, well, this isn't grounded in reality, or this is idealistic. And I think when we have a stakeholder group that works like ours does, you end up with both. You have a level of idealism, of really broad and innovative thinking, but we're also able to ground it within the realities of what it's like within the health service, or trying to access the health service, or in people's wider living circumstances. I think that's what enhances the research, because it allows us to overcome some of the weaknesses that we found in the existing evidence base.